From Flourish DX, this is the Psych Health and Safety Podcast. With workplace mental health becoming a safety prerogative, this is the source of information on psychological injury prevention and health promotion.
Listeners and viewers, welcome to the Psych Health and Safety Podcast. My name is Ian Lewis, and I'm one of the hosts of the show. The aim of the podcast is to rapidly increase the knowledge and application of psychological health and safety in organizations across the globe. And we get to speak with guests who are doing exactly that. And so today we are recording from Western Canada, and I'm so pleased to have Catherine Wilcox with us today. Welcome, Catherine.
Thanks so much, Ian. So happy to be here.
Yeah, thanks for joining us. Well, maybe can you tell our viewers and our listeners a little bit about you, your career path, and maybe the work that you're doing now?
Absolutely. So my name is Catherine. I use she and they pronouns, and I'm calling into our podcast today from the unceded ancestral homelands of the Lekwungen-speaking people of the Songhees and Esquimalt nations here in what we know colonially as Vancouver Island. So a little bit about me and my background. So I'm a registered clinical counselor in the province of BC. So kind of come into this work and conversation as a clinician. So my background is in mental health. I really got my start when it comes to psychological health and safety as a clinician working actually in a very trauma exposed environment. So I started out clinically working in the field of trauma. So I was working for a nonprofit as a clinician who was supporting people who had survived different forms of relational violence, intimate partner violence. And that's actually where I got my start as a leader. And so I think, my interest in psychological health and safety really started, when I began leading in these clinical programs, supporting staff that, again, were exposed to a lot of stories of violence, where risks like burnout, vicarious trauma, compassion fatigue were really, really palpable for us. And so environments of psychological health, were incredibly important, in that context to try to prevent injury to people. And so that's really, again, where I got really curious about psych health and safety and some of the things that I could do as a leader to support people. And from there, this was, back in 2007. And so before the National Standard for Psychological Health and Safety, the CSA standard, came out. And so in 2013, when that was released, I was so pulled to it. This idea that people were starting to talk about this and starting to explore all of these different contributing factors and a system, and people were really starting to name, psychological hazards and looking at that as part of safety. And so from there, I did some more training in psychological health and safety consulting and advising, and then took that into my work in healthcare, which is where I also worked for a number of years as a leader throughout the COVID-19 pandemic. That was where I was doing my work, and have the good fortune now of working in the transportation sector for TransLink.
Okay, so beginning very much as an individual clinician, but learning about the risks for the folks you work with when you were a leader, and now you've really kind of grown and expanded. You've worked in healthcare, and now you're working in transportation. And TransLink was one of the 2023 Canadian Workplace Wellbeing Award winners. For our viewers, who is TransLink? Like, who works there, and what sort of things would the folks at TransLink experience as they work then?
Yeah, so TransLink is the multimodal transportation authority for Metro Vancouver. So we're a very large, complex enterprise. We have about 8,500 employees across various operating companies. We move people, we get people in Metro Vancouver to the people, the places, the services that they need. So we have 1.3 million boardings on average in each weekday. So a lot of people moving through our system. Our transportation network in Metro Vancouver spans actually 21 municipalities. So, we have an important mandate. Our region continues to grow and expand. And so our enterprise is really there to meet the needs of our growing population and help to move people to the important, people and places and services that they need. And we do this through a family of companies. So, the Translink enterprise includes, a number of operating companies, including Coast Mountain Bus Company, BC Rapid Transit Company, Translink Corporate, and then also Translink actually has a dedicated policing service, also the Metro Vancouver Transit Police. So as you can see, there's a number of different roles that our people are in, and the risks, therefore, that across our enterprise, our employees would face could be quite unique, right? The risks, for example, that one might face in policing, could be very different than some of our corporate services staff, for example. The things that our bus operators and SkyTrain attendants, for example, might encounter out on our system, again, pose unique risks to them. They're working, with the public. They're supporting everyone in our community, right? Some of the folks out on our system, our employees, are responding to the drug toxicity crisis that we're facing here. They're interfacing with all members of our community that need transportation. So that could include people in emotional distress that are on our system as well. So I would say that there's a lot of diversity in terms of the types of psychological health and safety risks that our employees across our enterprise might face.
Right, so a real diversity in what they face, but also diversity in terms of your workforce. You'll have corporate staff, you'll have operators, you will have mechanics, you'll have electricians, you have public safety personnel, and so a real wide range of occupations and exposures, but also a very, very, I'm going to guess, very, very diverse workforce in terms of cultural values and everything else. Like there's a lot of intersectionality that's going to come in this job.
Absolutely. It's one of the things amongst many that I love about working for Translink is, our companies are incredibly rich in diversity in all of its dimensions. And it's a real privilege, working in the role that I hold, to be able to learn from, share, build bridges, connect, different areas of the company to really, and I'm sure we'll talk about this as we get into some of our programming, but also, to really highlight that there are so many diverse ways we understand well-being, what it means to be safe, what it means to be well, and really in a role like mine, I get the privilege of learning continuously, right? What these concepts actually mean to the people in our employment.
That's right, because you talk about learning about your workforce and what they need, and having ways to do that is absolutely essential. When we look at the National Standard of Canada, ISO 45003, other international recommendations around psychological health and safety, listening and understanding the needs of the workforce is really, really important. Now, as a very large organization, you've been doing mental health for a while then, I'm guessing, and maybe bring our listeners along on the journey to where Translink as an organization is now, but maybe where they started from when they were thinking about mental health in the workplace.
Yeah, absolutely. So this really has been a journey for Translink, to my understanding. I joined our company just about 18 months ago, so not even 2 years with Translink. So really, there was so much great work that had already been put in place by the time I arrived into my position. And so even before things like the COVID-19 pandemic, where I think the conversation really accelerated right around workplace mental health and well-being, given the nature of what we do, and again, some of the trauma exposure that our employees would encounter, things like critical incident, stress debriefing, are always incredibly important to TransLink. TransLink also had, well-being programs well in place, even again before the pandemic. And I think, that time and, also some, impactful events that, we went through as an enterprise around the same time as the pandemic really accelerated the need to bring some of these programs together into a more coherent system. And that's really, to my understanding, work that began to happen around 2021, 2022, where, again, and I'm sure many people listening out there, might be in a similar place where they have programming. They may have things like employee and family assistance services. Maybe there's, again, different programs that they're running that have components of well-being at the heart of them. And, there might be the desire to bring it together into a system that makes sense to people, and a system that can be evaluated, right? So back in 2022, that's when TransLink adopted, and our operating companies adopted psychological health and safety policies. The system was put into place, the psychological health and safety management system was put into place. So we have a working group, an enterprise working group around psychological health and safety. So that was established at that time, again, as a way of building more of a system and not just having a collection of programs. And so those were some of the initial steps, really, putting the right building blocks into place. And then, from there, building out programs that could really support a lot of the commitments that TransLink, has made to psychological health in the workplace.
Interesting. So I don't want to go too far back, but I'm just sort of curious. As a TransLink is a diverse group of companies, how long have they all been sort of joined and united under one banner? Is it like 5 years, 8 years, 20 years?
My understanding is 1999 is actually when TransLink came together in that enterprise formation.
Right. So then I'm guessing that the organization's relatively mature at sort of doing work together. But then in 2021, it was identified, let's do this in a more cohesive, integrated way. And so now then, where do you find yourself then in trying to craft a well-being strategy? Because you've got a diverse workforce, lots of strengths, lots of things to learn about. You've also got a bunch of different psychosocial hazards, things that have the potential to be harmful at work, but also a lot of workplace factors that, if they are increased, are likely going to be very helpful in the workforce. So how do you go about kind of learning what is and crafting that type of strategy? Because you've put into place a psychological health and safety management system, but now you've got to begin to gather data. So how does that work in such a big organization?
Yeah, it's such a great question, Ian. And I think really my way into it and developing, a strategy for, TransLink was really coming from some of the ways that I learned to do this work early. So, a lot of my experience initially came from the nonprofit sector, from healthcare, and we tend to run really lean, in those public sector, industries. So, how, what do you focus on, right? Where do you start? And that's often, the question that people have when they get into this work, like this is huge, right? The standard is large. It can feel really overwhelming. And so what I've always known to kind of fall back on and rely on is really, a relational approach to this work. It's, for me, a really critical step is building relationships with people. So, if we want to know what to focus on and what's important to people, I think we have to be having quality conversations and asking quality questions, within our organization, regardless of how big it is, right? We have to be having those conversations and building those relationships. And so that's a place that I always like to start from, regardless of the sector or industry I've done my work in, is, understanding, okay, what are the questions that I need to ask? How can I build trust to ask those questions too? I think that's really important. There can be, if we think about, engaging our workforce to tell us, right, what's important to you, what might harm you, what are those hazards? What are you concerned about? The quality of the answers that you're going to get back, I think, are dependent on the amount of trust in that relationship, right? So I think it does involve sometimes taking that approach of, I'm going to understand. I want to understand your work. I want to, and this comes from, just my training in kind of lean methodology. It's like, go to the site of the work, show up, put your face in the space. So
Yep.
so to
Put on your
speak.
PPE, get out there.
Yeah, get out there, talk to people, understand what their work is before you jump in and do a system or a program to them, right? And that's also something that I really learned working in healthcare too, is the importance of, first of all, seeking to understand, right? And then building that relationship, that trust, which will then, I think, allow you to ask some of the important questions that will help you understand, where do we need to focus? What's important? What do you actually think of this program? I'm actually a transit user myself. When I get around Metro Vancouver, I'm writing our system, and sometimes I'm writing it a lot because I'm commuting from Vancouver Island, and so it's been very helpful. And I've been a transit user for many years, to actually see and feel and experience what it's like out on our system, to notice the conditions that our people are working in. If I'm in our corporate office, right, taking a wander around, seeing what does it look like, what does it feel like, what's it like in our reception area, like what are the kind of conversations and interactions with the public that people are having. So I think understanding, building that trust, and then, finding ways of going about really trying to engage people in what you're doing. When, the strategy that I think you develop as an organization shouldn't be one person's strategy or idea around what the right thing to do is. It really needs to be more of a conversation. And that's where, again, relationships are really important.
So you have this diverse workforce operating, I'm going to guess, around the clock, 24/7. And the idea that, this might sound bad, in an ivory tower somewhere in Vancouver, you don't make decisions that affect the front line. You don't impose a program. But you know what? I need to go out and I need to meet the people who are doing the work. I need to understand the work. I need to gain that trust, that credibility. And I need to have that awareness of I can't presume to know the hazards or the strengths of this work environment. I need to gather some feedback. And so, like, how do you work through that? Like, I'm imagining, you could go on a very organizational approach and call the managers and say, I'm going to come down this day and ask these questions, or we're going to do this or that. Like, tactically on the ground, what have you been doing to gather the information? Because you got 8,500 people. This is huge.
Yeah, it's true. And you can't, have a one-to-one conversation with 8,500 people. So how do you, build those connections? And so I think making use of existing channels and worker representation, is one way of doing that as well. We also offered, so I developed the strategy for Translink Corporate for Wellbeing. And that was, a step that we took to do that was organizing employee focus groups. So that's a more formalized way as well. And those were open enrollment. So anybody who was interested was more than welcome to join in that process or have a one-to-one interview to provide their feedback. So that's another tactic that was used, and we gathered so much valuable feedback in that process. We could also, and we are looking at survey activity as well. I found with our focus groups, though, it really gave opportunity to have more of a conversation. So sometimes when we ask questions like, do you feel psychologically safe at work? Or, is your environment, one of trust or openness, and those, are, valuable things to ask, but they don't necessarily tell us what to do, right? Or what specifically we could do to kind of correct that condition, because we don't know. And going back to that idea of what does psychological safety or what does well-being mean? Do people, when they're answering these questions, even know what we're, asking about? And is what we're asking about understood in the same ways when we're interpreting that data? So having conversations that allow for follow-up questions or allow us to go a bit deeper and help draw out, what does that mean to you, and what would improvement look like, based on what's being shared. It was a very helpful process for us.
And have you been able to do these focus groups out in diverse areas of the work group or only certain areas?
Yeah, the focus groups we did were for the corporate area specifically. That is, my main area of responsibility, and our operating companies also have folks with comparable roles as well that, may have different tactics for collecting that type of, information and input, given the mobile nature of their workforces. So I know that my counterparts do a lot of work being out, in the system as well, at our depots and on the lines, just to, again, gather some of this feedback in the way that makes the most sense to that particular operating company.
Yeah, because they're all going to have different conditions. Now, you mentioned leveraging existing sort of feedback mechanisms and groups. Like, what are examples of some of the groups that you've been able to access within TransLink then?
Yeah, so within TransLink, at TransLink Corporate, for example, we have a peer-to-peer team, a peer support team that is quite familiar with a number of our programs and services. For TransLink Enterprise, we have an EDI task force, an Equity, Diversity, and Inclusion task force that I met with as well. We have an Indigenous Relations team also. And these were all groups that targeted outreach was conducted with, that have, representation, for our employees throughout our enterprise, that we could, get ideas, feedback from, input on the strategy, for example.
I see. And so when you go to those groups, then are you almost treating them like a focus group and bringing them questions, or are they giving feedback on existing programs and stuff? Like, what are examples of information that you're going to be able to draw from those different groups?
Yeah, so certain questions were brought in the case of our more recent, consultation around the strategy. So shared some proposed areas of focus with the group, and invited people to reflect on whether this felt in alignment, what activities and tactics we should use to kind of narrow our focus. So those, in those cases, we did bring specific questions and a specific focus to the groups.
So then it sounds like you've been collecting a lot of information mainly by focus groups. Why didn't you, kind of like go to the employee engagement survey, which is a very traditional route for a lot of people, or guarding minds at work, or administering some other well-being survey? Like, why didn't you do that? Because you could like push it to everyone's device and get her done and collate the data. Like,
Yeah, it's a really good question, because surveys, can provide really helpful information. I think that there is strength in doing that, and that is something that we've built into our 2-year strategy going forward, is asking survey questions, because you're right, you get a bigger reach potentially, depending on what your response rate is. We also do have engagement survey data that we were able to use to inform the strategy in part. I go back to that piece around the conversation and building trust and relationships with people, in terms of why we were starting with the focus groups. I think, again, it's a way of building connections and relationships in your company when you are having conversations with people, as opposed to just sending out the survey. So I think it depends on the culture of your company. Some workplaces are very accustomed to surveys. They do them regularly. They get high response rates. In other environments, like I think about our whole enterprise and how with a mobile workforce, surveying approaches might not work as well, right? People might not have access to even technology as part of their role. They might be, out on the road, for example. So, we do have to think a bit differently around how we engage people and gather their input and their feedback. So I think that those were some of the considerations.
Right. And so when you think about where you're at or where you were at, say 18 months ago when you joined the role, and where the organization was at, and what would yield the best data, the best sense of what we need, focus groups were the way to go because, well, sending out a survey logistically may not have worked, but also you talked about the building trust, and going slow may have been more important than going far at that juncture. Would that be accurate?
Mm-hmm. Yeah, I think that go slow approach is really helpful, especially when you're working to build trust, and if you're new, if you're coming in, for example, to an organization as a new person, again, building that trust and those relationships and that understanding, right, is really important. So when, and I have a consulting background, so I'm quite used to kind of bombing into organizations and being like, okay, what's going on here? What needs to be fixed, and then bombing out, right? However, when you're embedded in an organization, when you're, working with people, there's a different, I think, I've had better success, not only in my current role, I think, but in other roles I've held as well, like just coming in with that approach of, okay, I need to understand, I need to learn first before we move everything around and do a strategy. We really want to understand the strengths also of the current, system we have in place, and then build upon them. And, I just continue to also believe that relationships are really at the heart of psychological health and safety work. So that is an important way that I approach my work, and something that I think is actually key to the work too, because we are talking about systems that are designed for human beings, right? And to benefit human beings. And so we can't forget that we do our work in relationship with others. So we really do need to attend to what's going on in that relationship.
Do you need more psych health and safety in your life? Then head over to the FlourishDX Academy for several free on-demand e-learning courses. If you're an internal professional, follow FlourishDX on Eventbrite to register for any of our free fortnightly interactive webinars. Our flagship professional practice program is also exclusively available for internal professionals. The 12-week course blends theory, applied practice, and interaction with other professionals through live lectures and a monthly community of practice session. Find out more about all these learning opportunities or inquire about a bespoke in-house training at the FlourishDX Academy. www.45003.org. Now back to this episode.
Before you came to TransLink, they had a lot of good groups that were formed, around equity, diversity, inclusion, indigenous strategy, organizational development, HR. And you're like, okay, I'm going to use all of these. But somewhere in there must have been some pretty serious senior management commitment then to mental health and whatnot that you were able to sort of step into and have that time to say, let's take this slow. Let's understand the pieces, as opposed to, we'd like a well-being strategy in 6 weeks, please. You started 2 weeks ago. Let's go here, right? There must be some pretty serious senior management commitment there.
Yeah, we have some incredible leaders here at TransLink. I really have to say that really support this work and are willing to show vulnerability as well when we talk about things like mental health in the workplace. And I think that goes a long way. I do. I think a good management system in this area, really, it needs a lot of worker participation and worker input, and it also needs strong leadership commitment and support as well. And that can include leaders that show up, for your programs and your events, right? And that's something I'm always very curious about. Like when I look around or when something's offered, who's there? Like who shows up? Who's going to champion the work? Who's going to speak about it? Who's going to be vulnerable, and share, what they struggle with, including maybe their own, experience of life balance or their own mental health at times. And that does go a long way, I think, in showing that this is more than just words on paper, right? Like our policies and even our strategy, we've developed this strategy. It's, it shares what our intention is, but people will believe in your system once the action's taken, right? They need to experience it and see it. So again, really easy to make these commitments and put it in policy and put it together in a really well-formatted document. But then what do people actually experience in terms of their feeling, right, in the system? And what do they see you do, particularly in response to their feedback?
Right. And I'm not expecting Translink to be perfect, right? But you've talked about that they have been experiencing Translink's workplace mental health focus and efforts and programs for quite some time through critical incident debriefing, even efforts that would have been done during the pandemic, because of course transit kept running 24/7 during the pandemic. So lots of opportunities for people to touch and feel and see how the company operates, and I'm sure it hasn't gotten it 100% right every step of the way. That's all organizations. But now as you've done a lot of listening, and there's been focus groups, and you've been gathering data, now you're crafting a well-being strategy and really starting to pull together all these different pieces and understanding that there's Translink, can't share everything and lay it all out for us. But I guess where would you be sort of investing your efforts? Because of course you'll continue all the other mental health supports and things you're doing well. But where do you find yourself focusing then going into the future?
Yeah, it's such a great question. And thank you for highlighting that. I think it's really important that people know, I am so proud of the work that we're doing at TransLink and have done. And we still have so far to go as well, like you said, as all organizations do when it comes to this work. So, what are some of those things that we're working to improve, and where are we going into the future is a really great question. So coming back to this idea of, what it means to be well, to be healthy, to be psychologically healthy and safe, I think something that, we're really going to be focusing on in the next, couple of years, especially, is raising awareness and really highlighting that that is understood. The idea of well-being is understood diversely across cultures, that things like health inequity, for example, contribute even within our own company enterprise, right, to people's ability to access some of the programs and services that we offer, right? So I think we really need to look at and begin to expand, I think, just starting from that awareness perspective, the idea that well-being is understood diversely and it changes over time. And I think that's important because we do want to make sure that what we're offering in terms of our programs and services, that it is actually, taking that diversity into account, that, if there are barriers to people accessing, what we offer, that we're looking at that those are being addressed. So that will certainly be, a focus over the next couple of years for us in our well-being strategy. And, and as you mentioned, we as an organization, we're on a journey, right? We're evolving, we're evolving our strategy. And that's why we also made it 2 years, because we know we may need to pivot, right? We may need to do things differently as the conditions around us in the world, continue to evolve and change and grow as well. So, I think in terms of our innovation, it's really about listening, and a big area of focus for us in the next couple of years as well will really be teaching and supporting leaders to listen. So one of the things that I brought in the last year for the enterprise actually was a learning session. And it sounds very, very simple. It's called How to Talk to Employees About Their Well-Being. And so, again, I kind of keep coming back to these, simple ideas and principles. And and maybe that, again, is just the way I know how to do this work, but it's the idea of really training leaders to listen. And again, I know that sounds really, really simple. Just listen to people. And listening is not simple. And I say that as a professional listener, arguably, somebody that has been listening as a career, as a counselor for 20 years. There's a lot that gets in the way of listening to people. And I think that's the start, right? Like that's the start of creating the conditions for safety, is an environment where people do feel seen and heard and understood. So that's, we're starting from that place of really want to reinforce some of that foundational learning. How do you hold space for people? What gets in the way, including our own bias, for example, about things like mental health challenges? What do we believe and understand about mental health? What are some things to say? So it's very practical in the sense of, what do you say? What not to say as well. So we provide, some ideas, some scripts, some tools, because our leaders come in with different backgrounds, right? Some might have a lot of familiarity with things like, emotional intelligence and nonviolent communication and these different models, right, of having conversations. Some may be technical experts in their field, and they may not, have had the opportunity for that kind of formal training and formal reflection on, the way that I show up could actually impact the safety of the people around me. So what are some of the things I can look at in terms of my own behavior, my own choice of language that could make the difference between somebody reporting something to me or opening up to me or not.
Right. So two major themes there. One of training leaders so that they can listen and respond in ways that would reinforce psychological health and safety, that would reinforce support and well-being. But on the other hand, you're saying that understanding what well-being means for the diverse workforce, and that the workforce would be able to experience well-being. So that sounds a little bit less measurable than we trained 99% of leaders. If you were to say what potentially like a bus driver or a rapid transit operator would experience, and let's say that they were born someplace other than Canada, and they are experiencing maybe some financial strain, some work-life balance problems, and they are working for TransLink, what might they begin to experience, or what would you hope that they would begin to experience because of this work then? If we're talking like boots on the ground, coal face, we're on the shop floor, what might some of those people experience then as a result of the strategy, or what do you hope?
Yeah, so my hope would be, especially if we're talking about, this element of, people's understanding of health, well-being, the issues, the particular health, challenges that various employee groups might face might be very different, right? People's access to health and health resources can vary significantly as well. I would say, operators, SkyTrain attendants, any employee in our enterprise, like these groups are incredibly diverse also in and of themselves. My hope is that people will see themselves reflected, in the efforts that we take and the programs that we offer. So I'll give you some examples of that. So we have an enterprise newsletter called the Road to Wellness that really gives us the opportunity to kind of highlight what we're doing in terms of programs, but also gives us the opportunity to highlight certain days of acknowledgement, particular cultural observances. We also have a recipe section in that newsletter too. And let me tell you, one of the things I heard the most in our focus, I heard a lot of things in our focus groups, but people really love the recipes that we offer at TransLink. But an example, right? Where are those recipes sourced from? Do people see, again, their cultural traditions, observances, their cultural food reflected, right, in what's being highlighted? So that's one example. Another example is, we're working on a speaker series that we're going to be launching in the fall. And, it's an opportunity to, and again, because we're starting these conversations, to really hear from people what well-being means to them, or a particular, for example, resource group that they may be involved in. So we have employee resource groups at TransLink. We're very fortunate to have a number of them, and they have, their membership is kind of centered around, different things. Could be caregiving, could be, Pride and Allies. We have an Indigenous ERG, a multicultural ERG. And so we're really working with those leads to identify, well, what are the well-being topics that you would like to see explored in this speaker series? Would you like to, have somebody talk about the challenges, for example, that neurodiverse employees might, be facing, in the workplace? Would, we like to hear, about what well-being means in Indigenous contexts, right? It can be understood very differently. So, how do we, again, create programs that are highlighting? Sometimes when we think of wellness, right, we think about it in a very specific way, right? We think about the EFAP program, right? We think about, those types of pieces, which again are very important. And, also are they capturing, everybody's perspectives, worldviews, ideas. Even when we think about psychology, right, that comes from a Eurocentric tradition, right? To think about, where psychology comes from, and how, again, well-being has evolved, and there are different models and understandings. So, how can our programs really reflect that?
Right. So when you're talking about at the shop level, or at the out level of an operator, they should be experiencing, or you hope that they experience, a sense of belonging, that they see themselves reflected in the speaker series, that they see themselves reflected in the newsletter, that they know they can join an employee resource group, that resource group feeds up. But then also on the manager, supervisor end, you're hoping they experience then a psychologically safe leader as a result. That sounds like those are some major components then of your well-being strategy moving forward.
Absolutely. And I hope that people feel, and again, like, there's a lot of work that we need to do in this area, but I hope that people also feel that their ideas, their feedback is important, it's valued, and that it will be taken into consideration. We can't always act on the feedback that, people provide, right? Maybe there, is an operational challenge or a fiscal challenge, that prevents us from putting into place, something they would like to see. And again, in public sector, we tend to run really lean programs, but there are certain things that are free, right? Conversations are free, developing good relationships are free, asking questions with kindness and humility, that doesn't cost anything. And, I can tell you that, as a worker myself, some of the conditions, under which I felt the most psychologically safe were in relationships where, kindness and humility was what, was being displayed, to me by my leader, by my team. So that's, again, really where I would hope that we focus, some of our efforts.
Right. So kindness and humility aren't exactly numbers that are going to pop up on a dashboard. You talked about having 1.3, passengers a day. That's a very easy, quick metric. I imagine there's ways that the computer can generate that really, not easily, but readily. And those kind of numbers are necessary. But when you talk about sharing with leadership about your results, what do you share? Do you have a dashboard of succinct numbers, or like what helps them sort of see that maintaining the momentum in this strategy is important?
Yeah, 100%. Because we don't have sophisticated, systems. I would say for TransLink corporate measuring, psychological health and safety, we don't have like a push button report that can, show us all of the metrics in one go. However, we do have information, and many of it we need to assemble manually. So we pull data from different places, right? From benefits, from utilization of EFAP. We would pull information data about complaints and things like that, things that have been resolved. So a way of giving us a snapshot, right? Increasingly, and this is part of our strategy as well, like we really want to be more feedback informed. So, when we do have an offering, ensuring that we're asking, people to provide feedback if they would like to around, what was that experience like, so that we're offering, that we're building multiple feedback mechanisms into place. What we're doing is, because again, we don't have a system that does that automatically for us, is that we've committed to compiling an annual value on investment report, and our first one will be coming out this spring, that really highlights not only some of these metric pieces, but also some of the stories of impact that we know are happening throughout our enterprise. We know that people's lives at work and beyond it are being changed by the programs that we offer. So how do we, invite people to tell their story, to really demonstrate that human element as well? Because as I'm sure well know also, that sometimes the data that we have around psych health and safety, it's hard to attribute that solely to one particular program or intervention, right? It's like, how do we know that, sick time has been decreased because of this particular thing? It's not worth looking at that, but what are the other ways? So, we have participation metrics that we look at, but we'll be looking at these other methodologies as well to help support evaluation.
Yeah, that's exciting times. And there was a report that Deloitte Canada had authored back in 2019 that looked at organizations that implemented the national standard and collected data. And in the report, I'll maybe post the link later, they highlight that there are many, 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 many different data points. And it sounds like at Translink, you're saying, in our well-being strategy, we're going to pick and we're going to pull the data points that we think describes the most salient aspects of what we need in our workforce, because you've done a lot of time listening and gaining that trust. And I'm going to just hazard a guess, this is also a joint environment with unionized workers as well.
We have so many key partners in the work, our labor partners, again, our EDI partners, safety, occupational health, our people and culture, division, all of the divisions within Translink, operating companies. So, again, a lot of partners in the work that, we work to build relationships with and maintain and stay engaged in the process, right? My calendar is very busy these next couple of weeks. We've just finalized our strategy. So, thinking about yes, how do we go back to the people that have provided this input and ensure that they see it reflected in our plans now and what we're going to do.
Wow. So if you had some advice for people who are working in organizations that aren't necessarily as far along in the journey that Translink is, what advice would you have them as they are trying to get started and get some traction within psychological health and safety?
That's such a great question. Yeah, and every organization is, different depending on its sector and its size. But some of the basic things I would say is begin, right? It can feel really overwhelming because again, we look to some of the standards that we're looking against, and there's so much and so many components. But understanding that sometimes that perfectionism around wanting to do it all or do it in the proper way prevents us from even getting started, right? And I would say that a lot of this work is very iterative as well. So we have to do things. We might try things, especially if this is very new for your organization. You may try things that fall completely flat on people, that they don't attend, that don't resonate with them. And, not to take that as a signal that like this won't work here, or this is the wrong thing, or this is too much. But there's so much good learning in things not working out, in terms of understanding, okay, maybe a different approach is needed. And again, if you're working in a relational way, you might be able to even ask people, could you give me some feedback on maybe why this isn't landing, So I think that that's an important piece. And just remembering that relationship piece too, kind of going in with humility, again, curiosity. I think what we have to be careful about is, again, just creating a system and doing it to people and saying, here it is, participate, without people sort of, being engaged early and being a part of it. And I get like that can help us roll things out very efficiently and quickly. However, if people aren't really engaged early, they might not, again, see themselves reflected in the process and may be less likely to participate. So
yes, the advice is go slow, build relationships, get feedback, make mistakes. Not everyone's you're not gonna hit a home run first try.
Yeah, makes mistakes, learn from them, learn, to take accountability and move forward. Don't get stuck there, which is a place I think we can kind of get stuck at times where it's like, oh, this won't work here, or we don't have a culture that supports this. And it's like, well, again, looking at what can be learned, from what doesn't work out. Sometimes we have to take a step back, right? And we've been maybe moving too fast. So it makes me think about this idea of like, in order to have a quality conversation, we need to build that trust. So maybe it is more about doing more listening first, so that, when you are having those conversations, people actually, are providing you with the information that's really going to be valuable and help you build the best program that you can.
Wow. All right. That's great. Thank you so much for sharing your experience. Like you've walked us through decades of experience, from as a clinical counselor, as someone working in healthcare, someone who's worked as a consultant, now working at TransLink. But you've pulled a lot of learnings from lots of varied environments for our listeners. And that's one thing I really appreciate about the podcast, is that we are hearing from people all across the globe looking to implement psychological health and safety, workplace mental health, well-being, however we sort of frame the idea. But we are working with humans. We are working with people that respond to the things in the work environment. And when we don't consult and we don't invite participation and we think that we know better than everyone, it can fall flat. And gathering feedback, those iterative processes, sticking at it for the long haul. And so you've really brought all that to the forefront. And nothing that you have talked about today is contrary to the literature. In fact, it just validates, there's lots of research findings out there and you're like, yeah, me too. So I want to really thank you for sharing your experience and being generous with that. Because I think a lot of people are going to listen and learn that, yeah, I'm not alone. I understand that. I've faced that too. And we'll find that quite encouraging.
Thank you so much, Ian. I've really enjoyed our conversation today.
Yeah, well, thanks. So if listeners want to get in touch with you and maybe ask questions or follow you, is there any way that they can get in touch with you?
Yeah, the best way would probably be through LinkedIn. To find me on LinkedIn, Catherine Wilcox.
That sounds great. Well, thanks so much for the conversation today.
Thank you, Ian. I appreciate it.
And listeners, you can tune into us wherever you follow your podcasts. You can see previous episodes. There is a vault of information between the Canadian, UK, Australian, and American versions of this podcast. So thanks so much for listening today.
You've been listening to the Psych Health and Safety Podcast. To stay up to date with the latest on psychological injury prevention, follow Flourish DX on LinkedIn and subscribe to the Psych Health and Safety Podcast at www.psychealthandsafety.com.